Hello, hi. I am Dr. Manojendra Narayan Bhattacharyya, consultant ENT Head and Neck Surgeon at Peerless Hospital, Calcutta. Today we'll be discussing about a very important topic, which is a thyroid swelling. Thyroid is a gland which is in front of the neck, in front of the airway, and it has many conditions. We will be discussing about that condition today. As I have already mentioned that thyroid is a gland which is in front of the neck, in front of the airway. It has three parts which are called the left and the right lobes and the interconnecting part which is called the isthmus. It is supplied by many blood vessels from either side of the neck, and as you can see it here, it lies over the structure which is called as the trachea. Now, as from this photograph, you can see that only a part of the thyroid can be swollen, or the whole of the thyroid can be swollen, or there can be a small swelling inside the thyroid gland which reveals as a nodule. So these are the variety of swellings with which a patient can come to us in the clinic. Now, a patient can come to us with complaints of a lump in the neck, which sometimes grows bigger very quickly. There can be only a swelling, they can come with that. There can be a pain in the swelling, and sometimes the pain gets referred to the ears. There can be change in voice, particularly hoarseness of voice with which they can come. There can be trouble in swallowing, or even some difficulty in breathing, particularly on lying down, or there can be a constant cough, but not having any cold. So these are the symptoms with which the patient can come. Sometimes it can be an incidental finding when there had been a scan done of the neck for some different reason, and we could find out that there is a swelling in the thyroid. Now, if we talk about the incidence of this in India, the thyroid gland swelling in India is between 1 to 5% of the population, and most of these thyroid swellings are benign, that means non-cancerous. 5 to 15% of all the thyroid swellings are malignant or cancerous in nature. There are 5 common types of conditions of the thyroid in India. One is hypothyroidism, where the thyroid produces less amount of thyroid hormone or thyroid juice. Hyper, the reverse of it, where they produce more. There can be a goiter, that is a benign big swelling of the gland. There can be Hashimoto's thyroiditis, which means that it's an inflammatory autoimmune condition of the thyroid, or there can be a cancer of the thyroid. If we talk about the cancer of the thyroid, few conditions aggravates the thyroid cancer, like younger age group, male population, past history of radiation to the neck, family history of thyroid cancers. Now, once a patient comes to us in the clinic, we have a look, we take the history, and then we do some investigations. What are the investigations we do? Important is blood investigation, where we figure out the amount of hormone which the thyroid produces in the blood, like free T3, free T4, TSH, and sometimes antithyroid peroxidase. We do an imaging. Ultrasound or USG of the thyroid is the imaging of choice. Sometimes we do USG elastography, which tells us about the nodule or the swelling inside the thyroid. whether it is benign or malignant. It gives us an indication of it. Sometimes CT scan or PET scan is also done along with that. And then we put a needle inside the thyroid under ultrasound guidance, which is called FNSC, under USG guidance, to pick up some cells, and is sent to the pathologist to figure out what kind of swelling it is. So we take a picture of the thyroid by imaging to see the nature of the swelling, and also we look at and we examine the cells of the thyroid to figure out what type of swelling it is. And then accordingly we chalk out a treatment plan. Once we get the FNSC and the imaging result, we can ascertain what sort of tumor of the thyroid the patient is having, whether it's a benign tumor or a malignant tumor. If it is a benign tumor, then we go for conservative management and we keep the patient for follow-up. But in some cases of benign tumors, if it is big enough to cause cosmetic problems, if it causes compression over the windpipe or the food pipe, causing difficulty in breathing or swallowing, then we recommend surgery. In cases of malignant or highly suspicion of malignant tumor of the thyroid, we recommend surgery where the thyroid is removed. A small cut is made in the front of the neck, and then after meticulous dissection, the thyroid gland is removed, and again the cut margins are stitched properly. After the surgery, if it is malignant, there is a protocol which we follow where we sometimes give the patient radioiodine therapy to kill any traces of thyroid cells which are present in the body. If along with that there are some glands which are called lymph nodes which are also affected, then we sometimes needs to clear up those glands during the surgery. The surgery can cause scar, bleeding, or hoarseness of voice, or low calcium level. But having said that, hoarseness of voice is due to injury to a nerve which runs very close to the thyroid gland, which is called recurrent laryngeal nerve. But we do meticulous dissection in separating the nerve from the thyroid gland before its removal. And low calcium level is due to another gland which is called parathyroid, which is adhered to the thyroid gland. We again meticulously dissect that parathyroid and keep it in the body so that the chances of low calcium in the body is minimized. Thus, in a nutshell, I can say that nowadays more cases of thyroid tumors are found in our country. This is because of improved imaging. Early detection is a boon, as the outcome of treatment in early detection of thyroid tumors is excellent. Thank you. Namaskar.